It is a conversation many of us avoid, especially in our 20s and 30s, but doctors say colorectal cancer isn't just your grandparents' disease anymore. Here with us on this Mindful Monday is Dr. Colin Kennedy, General Surgeon at Winona Health, to break down what we need to know during this Colorectal Cancer Awareness Month. Good morning, Dr. Kennedy. Thanks for being here.
Thank you so much for having me.
Yeah, nice to see you. So let's just start with the basics. Why is colonoscopy such an important screening tool? We hear so much about it.
Yeah, it's a really important tool for a couple of reasons. One, it can help us detect colon cancers early so that we can treat them before they become much more advanced disease. The other really important thing is that it can help us detect and remove precancerous polyps. And by doing that, we prevent people from getting colon cancers.
Okay, two very important things there.
Yeah, so this can still be fun. I know it's a little bit scary. A lot of folks become nervous about this, but so what are the things that you would do to help folks to stop to be nervous or help them from being nervous?
Yeah, I think, you know, it's kind of a topic nobody really likes to talk about or think about, but it's important to remember that it's just part of our body like anything else. And I think also people hear kind of the war stories of other people. And really, most of the patients that I take care of say, you know, it's really not as bad as I thought it was. The prep's not fun, but it's not the end of the world.
And I'm sure you're glad when it's done, right?
Yeah, and you know, it's one of those things that if it helps prevent colon cancer, it's well worth it.
Well worth it for sure, yeah. So we are seeing, you know, statistics showing more young people being diagnosed with colorectal cancer. We know that, you know, there's definitely no for sure factors behind that, but what are you seeing, what are you thinking is behind this trend?
I think it's probably multifactorial. So I think there's certainly a genetic component to colorectal cancer. We've known that for a long time. I think that there's also some lifestyle things that probably contribute to the increased rates that we're seeing. So things like obesity, alcohol consumption, smoking, and then some of the foods that we eat as well.
Okay. And so what can we do, you know, young people, people of all ages, to try to reduce that risk?
So I think a lot of it is the stuff that we've always been told, right? So maintain a healthy, active lifestyle, work to maintain a healthy weight, avoid excessive alcohol consumption. If you don't smoke, don't start. If you do smoke, quit. And then when it comes to some of the dietary things, make sure we're eating a healthy, balanced diet that's high in fruits and vegetables, high in fiber, and that limits our consumption of processed foods and probably limits our consumption of red meats as well.
Okay. And any like red flags or warning symptoms, when should we reach out to our doctors?
Yeah, that's a great question. So if you start noticing blood in your stool or with bowel movements, that's something to talk to your doctor about. Or if you start having kind of chronic abdominal pain, problems with constipation, bloating, all of those things can be signs that there's something going on.
Okay.
Yeah, your parents used to say back, just drink more water, but that's not always the issue, correct?
It's not always, although hydration is important.
Right, yeah, that's an important factor. Okay.
So also folks have been, the screening age is lowered now down to 45. So what are we going to see about the folks that are going to be getting, I should say, let's look at this a different way. Let's put this, someone that is at higher risk.
Yeah, so we did recently lower the screening age to 45, and that's because unfortunately we used to start screening at age 50, and we'd have people come in who had done all the right things, right? They talked to their doctor. When they turned 50, they got their first colonoscopy, and we were finding advanced colon cancers. And so why we're finding them earlier in people, I don't think we really know. Again, it's probably multifactorial. I think the most important thing to do, though, is make sure that you're getting your routine screening colonoscopies when you turn 45. And if you know that you have risk factors for colon cancer or a strong family history of colon cancer, talk to your doctor earlier to see if you need to get screened before 45 or if you need to have more frequent screenings.
Okay, screening and prevention, key tools there we know.
Absolutely.
Thank you so much, Dr. Kennedy, for being here.
Thank you, guys.
No problem.